My name is Alexis. I'm a senior rad tech student here at Atlanta Technical College, and I'm here to talk to you all about osteonecrosis and pancreatitis. Our bones rely on oxygen and nutrients that are delivered to us through the blood. When osteonecrosis occurs, that means the blood supply that is being delivered to the bone has now been interrupted. It weakens the bone over time and can cause the bone to collapse. It can cause arthritis, severe pain, and it can completely damage the joint if left untreated. Osteonecrosis can occur in any bone in the body, but it is most commonly found in the femoral head of the hip. For the process of bone remodeling, the bone is constantly being broken down and rebuilt. In order for our bones to adequately do this, our bones need blood supply. Once the bone loses blood supply, it dies. Once it dies, tiny fractures develop because the foundation of the bone has been disrupted. The bone begins to collapse. Once the joint surface starts to collect, arthritis will develop. Osteonecrosis is a slow process, usually developing over months, years, and sometimes has no symptoms at all. Osteonecrosis has a major impact on the body. The impact is gradual and includes the destruction of the affected joint. Once the affected joint is destructed, the joint becomes unstable. This affects a patient's mobility, range of motion, and causes severe pain. The hip is a common site for osteonecrosis because it bears most of the weight from our bodies. If osteonecrosis causes the femoral head to collapse, most patients will require a total hip replacement. As mentioned before, symptoms of osteonecrosis are gradual. They usually begin with deep aching pain when bearing weight, especially on the hip joint. It makes it very difficult to climb stairs, to lift things, to bend. Overall, it reduces a patient's range of motion. Osteonecrosis most commonly affects individuals between the age range of 30 and 50. It also affects heavy alcohol users, individuals that have received organ transplants, patients with lupus, patients with sickle cell, patients receiving chemotherapy, and so on. Causes and risk factors include traumatic injuries, previous fractures, hip dislocations, blood clotting disorders, and sickle cell anemia, just to name a few. There are several conditions that can reduce the blood flow to the bone. Some include traumatic injuries, fractures, radiation exposure, excessive alcohol consumption, as previously mentioned, sickle cell anemia, blood clotting disorders, just to name a few. Medical imaging is extremely important in discovering and diagnosing osteonecrosis. Diagnostic imaging is usually the first imaging modality that is performed when osteonecrosis is suspected. If osteonecrosis is present, there will be an increase in bone density, flattening of the femoral head, collapse of the articular surface, joint space narrowing, and a crescent sign that will all be able to be detected on a diagnostic radiograph. The crescent sign is one of the most popular findings in a diagnostic radiograph when osteonecrosis is present. It represents a small fracture beneath the cartilage. MRI is the most sensitive imaging modality for osteonecrosis. MRIs can detect diseases before they become visible on a diagnostic radiograph. Some MRI findings include bone marrow edema, areas of dead bone, precise measurement of a lesion size, to name a few. CT provides excellent visualization of bone collapse, small fractures, joint surface irregularities. Bone scan can also be done using nuclear medicine. Treatment for osteonecrosis varies patient by patient and is all dependent on how advanced the disease is. In the earlier stages, physical therapy may be used, pain medications, reducing weight-bearing activity, and maybe even minor surgery. More advanced diseases will require bone grading, partial joint replacement, or a total hip replacement. Without treatment, osteonecrosis will progress over time and will cause patients severe pain. Once the bone does collapse, the damage has now become irreversible. To conclude, osteonecrosis is a serious condition that leads to the loss of blood supply to the bone and causes the bone to die. It is essential that osteonecrosis is detected in its earlier stages. That way it is treatable and the irreversible joint damage is less likely. Now we will move on to pancreatitis. Pancreatitis, by medical definition, is the inflammation of the pancreas. Pancreas is a gland that sits posteriorly to the stomach. It plays an essential role in digestion and blood sugar regulation. The pancreas has digestive enzymes that help break down fats, proteins, and carbohydrates in the small intestine. It also produces important hormones like insulin and glucagon, which help to regulate blood sugar levels. In a normal, healthy digestive system, digestive enzymes remain inactive until they reach the small intestine. Pancreatitis is present. These enzymes become reactive while still inside the pancreas. This causes the organ to digest its own tissue. When this process occurs, it results in swelling, a buildup of fluid, severe pain, and in more serious cases, it involves complete and permanent damage to the pancreas. When you hear about pancreatitis, you hear about acute pancreatitis and chronic pancreatitis. Acute pancreatitis is a sudden onset and can typically be resolved with treatment. Chronic pancreatitis typically be resolved with treatment. Chronic pancreatitis causes damage that is irreversible to the pancreas. Pancreas is divided into two parts, one being the exocrine pancreas and one being the endocrine pancreas. When digestive enzymes get trapped in the pancreas, instead of them breaking down food, they end up breaking down pancreatic tissue. It occurs, an individual may notice bleeding and swelling. This is a repeated event. An individual may suffer from loss of pancreatic function, chronic pain, and inflammation that will result in scar tissue over time. Some effects on the body include weight loss, digestion, inflammation of the abdominal area, diabetes. Vary from individual to individual. This is mainly based on whether the pancreatitis is acute or chronic. Some symptoms include pain that travels to the back area, fever, abdominal tenderness, rapid heart rate, and nausea and vomiting. Chronic pancreatitis, some symptoms include chronic back pain, weight loss, diabetes, poor digestion, abdominal pain. Chronic pancreatitis. As the disease progresses, pain may lessen as a result of the pancreatic tissue being completely damaged. Pancreatitis can occur at any age in an individual, but it is most common in adults. Individuals that have an increased risk of pancreatitis include heavy alcohol users, smokers, individuals with gallstones or previous gallstones, individuals with autoimmune diseases, and taking certain medications. Some of the most common causes include abdominal trauma, pancreatic cancer diseases, and gallstones blocking the pancreatic duct. Medical imaging is highly used in discovering and diagnosing pancreatitis. Ultrasound is typically the first imaging modality a physician will order if pancreatitis is suspected. Demonstrate a fluid buildup, gallstones, pancreatic swelling, and bile duct. CT is the most common imaging modality used in pancreatitis. CT scan can find an enlarged pancreas, inflammation, hemorrhaging, and abscesses. MRI provides excellent soft tissue detail, useful for evaluating necrosis, flections, pancreatic inflammation, and evaluating the pancreatic duct. He is not routinely used, but is essential when performing the removal of gallstones or when gallstones obstruct the bile or pancreatic duct. Pancreatitis is dependent on how early the pancreatitis was discovered and if it is acute or chronic. Fluids, fasting, pain management. For chronic pancreatitis, it may include pancreatic enzyme replacement therapy, insulin therapy, dietary modifications, in select patients. If gallstones are present, an ERCP may be performed. Many individuals with pancreatitis usually recover within a couple days, all dependent on the type of treatment they receive for their pancreatitis. And pancreatitis is an inflammatory disease of the pancreas. This is caused by premature activation of the digestive enzymes that eventually affect the pancreatic tissue. And speedy treatment is essential, preventing serious complications and further damage to the pancreas. Ultrasound is the most commonly used imaging modality for pancreatitis. CT is preferred.